Hi, I am Dr. Lin Huiyu, a practicing consultant gastroenterologist from Tock Seng Hospital. I have a subspecialty interest in inflammatory bowel diseases, and I'm one of the 3 physicians actively involved in the IBD team at Tock Seng Hospital. Today, I will be sharing with you about Crohn's disease in adult patients. In our first segment, we will talk about understanding Crohn's disease. First and foremost, what is Crohn's disease? Inflammatory bowel disease, also known as IBD, is a term used to describe 2 conditions: ulcerative colitis and Crohn's disease. Crohn's is a chronic inflammatory condition of the digestive system and may affect any part of the gut from the mouth to the anus. The ulceration and inflammation of the gut affects the body's ability to digest food, absorb nutrients, and get rid of waste in a normal or healthy way. And although any part of the GI tract, from the mouth to the stomach, to the small intestine, or to the large intestine is possibly involved, the most commonly affected portion is the last part of the small intestine, also known as the terminal ileum, as well as the colon. The inflammation can affect the entire thickness of the bowel wall, which is unlike in ulcerative colitis, where the lining only is affected. Inflammation in Crohn's is patchy. It can skip or leave normal areas between segments of diseased intestine. Who exactly is affected by IBD? In 2017, there were 6.8 million cases of IBD globally, and IBD affects an estimated 3 million Americans. Both men and women are equally likely to be affected by Crohn's. And while IBD is traditionally more common in Caucasians and in developed countries, it is increasingly common in Asia. The disease can occur at any age, but Crohn's is most often diagnosed in adolescents and adults between the ages of 20 and 30. Studies have shown that between 1.5 and 28% of people with IBD have a first-degree relative, such as a parent, child, or sibling, who also has one of the diseases. Nonetheless, it is not possible to predict who may get Crohn's disease based on family history alone. Within Singapore, approximately 1,500 people living with IBD. Of the Malays, Chinese, and Indians in Singapore, Indians appear to have the highest incidence of Crohn's. Over the past 2 decades, while IBD in Asia, including Singapore, has risen significantly, it is still considered relatively lower compared to Western countries, and therefore sometimes misdiagnosed as other conditions such as GI tuberculosis or irritable bowel syndrome, leading to delays in treatment. In a recent study, which was a systematic analysis of the global burden of diseases involving almost 200 countries and territories between 1990 and 2017, Singapore had the lowest age standardized death rate, which indicated better outcomes. The exact cause of Crohn's is unknown despite much research. However, we do know that IBD is a result of a defective immune system. While a well-functioning immune system targets foreign bodies such as viruses and bacteria to protect the body, in IBD, the immune system responds inappropriately to various triggers, which causes inflammation of the GI tract. While there is no one single cause of Crohn's, researchers believe that it is a combination of factors that contribute to the disease. This includes a genetic or hereditary component and abnormalities in the gut microbiota. Smoking, diet, and stress are thought to aggravate the condition too. In the next segment, we will talk about what to do if you are suspecting Crohn's disease.